I understand that the following information will be gathered and utilized for educational purposes by an Indiana Wesleyan University student. I give my permission for this information gathering and physical assessment to be filmed and posted on Blackboard for access by faculty and students at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only, and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the student, are not considered liable.
Hello, this is Martin.
Hi.
Hi, nice to meet you.
Nice to meet you too.
I'm Sarah. I'm going to be your nurse today. I'm going to ask you a few questions. What brought you into the doctor's office today?
Well, I've been having a lot of anxiety, some weight gain, headaches, mood swings, and I haven't had a period for 4 months now.
So you've not had a period in 4 months?
Mm-mm.
Any past medical history?
Well, I have sleep apnea, and I use a CPAP at night, and I have been using it for a year. I have some hypertension, so I take medicine for that.
Any other problems or anything that you might be experiencing?
Little joint pain.
Joint pain? Is that new and recent?
Very recent.
Okay. Are you on any medications that you be aware of?
Lisinopril for the hypertension. Seasonal allergy medicine, which is Claritin. And 1-a-day multivitamin.
Okay. How tall are you?
5'3",
And how much do you weigh?
185 pounds.
Okay. Any allergies to any drugs or anything like that?
Just the seasonal allergies.
Okay. Seasonal. The aide came in earlier and got your vitals for me, and I was going to go over that with you. Your blood pressure was really good at 124/76, but your heart rate was a little fast at 115. Are you feeling a little anxious?
Well, I think I am. I'm anxious now for having to come in here, and I've just been having a lot of anxiety lately, so it probably has to do with that.
Okay. And your temp was good at 98 even, and your respirations, which is the way you're breathing, was all normal. It was at 20. I'm just going to take a quick listen to you, and just look you over, and I'll probably be touching you. Is that okay?
Yes.
Okay. Deep breath. Okay, I'm just going to listen to your heart here. Your lungs are all clear, but your heart is beating really fast. I can definitely hear that. Good pulses. Are you feeling real anxious right now?
Yeah.
Okay. Now listen to your belly. Yep. Just because you're having no periods and stuff like that, I'm going to really focus on your belly and be pressing on you, okay?
All right.
Any problems with your bowel movements?
No, but I have frequent urination.
No problems when I press?
No.
Frequent urination? Okay. Can I take a look at your legs here? Okay. No swelling. A little dryness in your legs here.
Yes.
Your pulses are really good. I did hear you tell me that you had some joint pain,
Mm-hmm.
and that was all new for you. Where's your joint pain at mostly?
Mostly in this left leg, knee, and in the hip.
Okay. Can you stand up for me? Does that hurt to stand?
Yes.
Okay.
After I stand for a while, it loosens up a little bit.
Okay.
In the morning, it takes me I have to stretch a little bit before I can get out of bed.
Okay. And that's, with joint pain, that's to be expected. Definitely try to stretch that out a little bit. With your fast heart rate, are you experiencing any kind of stressors or anything like that?
Well, my husband was diagnosed with a muscular disease, and he's on disability, and he's been on it for 2 years now. And I'm trying to be retired and financially support him and his medications, and my son is going to college right now, so financially it's been a little tough.
A lot of stressors. Are you on any kind of diet that I should be aware of?
No, but as you can see, I need one.
Well, it seems to me that a lot of the symptoms that you're having, such as you feel a lot of anxiety, you're saying you're having a little weight gain, headaches, mood swings, joint pain, and then the no period, that you may be experiencing menopause. It's pretty typical with your age. Between the ages of 45 to 55 is when we usually see that. And I can't diagnose you, but I will be telling the doctor all your signs and symptoms, and he'll probably come in and want to do a blood test and maybe even a pap smear. With that diet, we're going to definitely want to get you on a diet that will help with reducing your weight gain, because you will probably be experiencing that, and also increasing your calcium foods and increasing stuff with calcium.
With the gynecologist, I'm having a little bit of vaginal dryness too, and it's so like sexual intercourse is very uncomfortable right now.
Okay.
So maybe you can address that with the doctor too.
Yep. There's several creams that they have out there. And we'll definitely talk with your gynecologist about that, since you see him regularly, I'm assuming.
Mm-hmm.
Who is your gynecologist?
Steve Walls.
Okay. Well, like I said, there are some creams out there and stuff like that. With the anxiety and stuff, do you have a good support system?
My family's very supportive. I have a Bible study group once or twice a week. And I have a clogging group, and they're just like family, and we support each other, and I see them several times a week too.
Okay. Well, that's good. I want you to definitely be able to have people to go talk to and stuff like that. Try to reduce the mood swings, reduce the stressors and the anxiety. And like I said, I'll be taking this information to the doctor, and we'll come up with a plan of care for you, such as the diet, stuff to reduce your anxiety, maybe even some support groups too.
Okay.
Does that sound good to you? Have any other questions for me? Okay.
No, but thanks for taking your time.
Well, thank you for letting me listen to you and taking the time too. Thank you.